All right, perhaps because we thought we were doing pretty well here in BC, the concept of mandatory vaccines seems kind of, redundant. But it actually sounds like this might be in the planning works. In response to being asked why the unvaccinated should be accommodated, federal Conservative leader Erin O'Toole said the focus, this is in a press conference, said the focus should be on giving Canadians the tools to prevent transmission.
What we found with Omicron, if you actually look in a total way at the data, is you're also going to have some hospitalization and a lower number of ICU admission for people that are fully vaccinated. In some cases, even with the booster, as we're seeing out of Denmark and other studies that are literally being watched on a daily basis. The more we can give all Canadians tools to keep the spread down and to keep normalcy to life is what we have to be doing. What is crazy is we haven't learned the lessons from the first wave. We're back to ordering PPE for Parliament Hill from China. We haven't delivered the rapid tests promised almost 2 years ago on his doorstep. He orders them in the middle of the fourth wave. That's unacceptable. So we need to keep strain off the healthcare system as much as possible, and giving Canadians, communities, schools those tools is part of that.
Some good points there from Erin O'Toole, the head of the Conservative Party. But Federal Health Minister Jean-Yves Duclos mentioned last week that, a possible mandate for mandatory vaccinations for all Canadians could be a possibility.
I personally think we will get there at some point. Mandatory vaccination. There will always be exceptions, of course. People who have medical reasons to be exempt will be allowed not to get vaccinated. But what we're seeing now, what we felt would come a few weeks ago, what we're seeing throughout the world, we know that COVID-19 will be with us for many more months to come, maybe even many years. Given how fragile our healthcare system is in Canada, our aging population, increasing costs associated with taking care with everyone. I think this type of measure, which is not being considered now, and we understand why, but it will be part of what people think about in provinces and what they think they could put into their action plans.
That's all the time we have. A little bit complicated there, I know, because we have the voice translation over the actual conversation, the press conference from Federal Health Minister Jean-Yves Duclos talking about the possibility of a mandated vaccination. Federal Conservative leader Erin O'Toole actually was on the Mike Smith show just this morning, and he was asked about the possibility of federal mandate for mandatory vaccinations. Here's what he had to say about that.
Well, this is more diversion by the federal Liberals. They don't deliver the tools they need to Premier Horgan and other people, and then they suggest things that aren't even in their control. Duclos is not even following his own department's guidance, Mike, on getting vaccine levels up. You talk to any experts to get some of the people that still haven't done it after a full year, the more you turn it into an attack and a very polarized environment, those people get more hesitant. So what we have to do is encourage and educate as much as possible. Canadians have largely done their part. I wish everyone did get vaccinated, but it is a personal decision.
So that was Erin O'Toole talking about the mandatory vaccinations and made some really good points there. I mean, do we need to do mandatory vaccinations? Maybe we should be focusing on some of the things that were promised by the Liberals in the last election and at the beginning of this pandemic. And so, all this, could create all sorts of problems, and legally, ethically, communicatively. One organization that's very concerned about the concept of mandatory vaccinations is the Canadian Civil Liberties Association. Joining me now is Kara Zwiebel. She's the Director of Fundamental Freedoms and Acting General Counsel at the Canadian Civil Liberties Association. Hi, Kara.
Hi, thanks for having me.
No problem. So this, it's a bit that was a bit, I don't know if you heard a clip with the minister, but I mean,
yeah.
He was elusive a little bit, but it sounds like they're certainly playing around with this idea. And I'm wondering if this is more of an East Coast thing than a West Coast thing because of what we're seeing in Quebec. But what, does this surprise you that this is actually 2 years into a pandemic, that this is what we're talking about?
It does surprise me, even though at this point it probably shouldn't. Because I keep thinking, no, that's not something we would do here, and then we do many of those things. But I think actually, at some point in the clip, the minister does say that this is something that would fall to the provinces, which so it's interesting to sort of throw it out as an idea and then almost immediately say, it's not something we would do. So, but I think it speaks to, a general trend, which is that we really are now, and have been for some time, politicizing what's going on, and we need to get back to focusing on using the evidence and following the science. And I'm not sure that there's anyone at the Public Health Agency of Canada that has suggested that we should be instituting a mandatory vaccination plan. I'm fairly certain that's not a suggestion that has been raised.
Not that I've heard.
So I think, it's sort of unfortunate that it was thrown out in this sort of offhand way, because I think it does, unfortunately, make some people who are already hesitant even more nervous.
I mean, is this the concern over the control by state over the people? And even though the argument is related to health, that this is more about freedoms and that this is a slippery slope?
Yeah, I think the concern is, people have, we have particular ideas about, our bodies and the sanctity of them, and the idea that the state doesn't have the right to intrude upon them. So I think when people start hearing ideas like this, they get concerned, and I understand why. I also think that the minister said something about, of course there would be exceptions for people who can't be vaccinated, but if you look at what's been happening in the provinces across the country, with other types of vaccine mandates, so in the employment context, or in order to get a vaccine certificate to access certain public spaces, we've been interpreting those medical exemptions very narrowly, and I've spoken to many people who have complicated medical histories, who have overlapping disabilities, and some of them have said, I don't fit into these categories that the government says are the only exceptions for not being vaccinated. But, I have a healthcare provider who's told me they don't think it's a good idea for me personally. So I don't know what people in that situation are really supposed to do. And I do think we also need to, obviously it's been a long time, and it's unfortunate that some people still aren't convinced of the safety and efficacy of the vaccines, which I think, there's evidence all around that they are doing, what they were supposed to do. And unfortunately, I think people did have this idea that the vaccines were the sort of silver bullet,
right.
and they're not, right? You still can get the virus, you still can transmit the virus, but they are keeping many people from dying and getting seriously ill, and that's a very, very good thing. So,
yeah. For sure. But I think that that's why I think it's surprising that this is coming up now. And doesn't it make you a little suspicious that maybe is there a hidden agenda here about control by the state that's going on, or is it just dumb politicians saying something they shouldn't be saying and not thinking it through?
Yeah, I don't know what it's about. I know that it's become, it's become very popular to really, denigrate people who are not vaccinated, to really try and stigmatize them, to sort of, they're the ones that aren't doing their part. And I think that, unfortunately, that's, certainly there are some people who are, unfortunately, very badly misinformed, have very bad and wrong ideas about the vaccine. But there are also people who just want more time, who feel, who feel nervous about it, who've had bad reactions to other vaccines and are worried about this. And I just think that, raising this idea is just not a helpful contribution to the debate.
And Canada's doing so much better than anywhere else. We know that, say, in Austria, where they are mandating it, where they were having a challenge because they couldn't get people. They couldn't get to even 60%. There are countries that are having much more challenges to this, and the argument for mandating might be stronger. But certainly when we're pushing 90% here in British Columbia, and other provinces are 70, 80, 90%, and higher, some of them in the Atlantic Canada, it seems like this is coming from an area that because we're seeing what's happening in Quebec. Is there a bias of thought by this minister that because he's from Quebec and he's seeing the world through Quebec's lens?
Yeah, I don't know. I mean, I do think that the comparison to some of the European countries is not an apt one. I mean, we like you said, we have much higher vaccination rates. We've been very compliant. We have people lining up, at least here in Ontario, to try and get boosters. Most people want the vaccine.
Yeah.
So I don't, and I think it also is unfortunate because, again, it's suggesting that, there's something we can do that will end the pandemic. And unfortunately, as much as it breaks my heart to say this, I don't actually think it's entirely within our power. I mean, if all of Canada were vaccinated, we'd still have a global pandemic on, and we would, until we get the rest of the world vaccinated, we'll still have variants, and the possibility that those variants will evade the vaccine.
And maybe that should be our focus. The world, as opposed to just our own backyard. Kara, thanks very much for joining me.
Thank you.
Thanks. That's Kara Zwiebel. She's the Director of Fundamental Freedoms and Acting General Counsel for the Canadian Civil Liberties Association. What do you think?